Resident doctors in England, formerly known as junior doctors, have begun a 5-day walkout in their continuing dispute over pay with the government. Over the last 3 years, they've received a pay rise of almost 30%, taking their basic starting salary to just below £39,000 per year. But the British Medical Association wants a further 26% pay rise over the next few years, as well as more training places. Our health correspondent Rebecca Barry reports from the Royal Berkshire Hospital in Reading.
We've been here since early this morning as this busy emergency department copes with half their usual number of resident doctors. Senior doctors, consultants are having to stand in for their colleagues out on the picket line. Resident doctors, who used to be known as junior doctors, have had around a 30% pay rise in recent years, but their union, the BMA, wants a further 26% rise over the next few years to make up for years of pay erosion, and they want more training places. The Health Secretary has made it clear he will not move on pay, and earlier this week he could hardly disguise his fury, describing the BMA of behaving like a cartel. This is the 13th strike by resident doctors in the last few years, and it not only impacts patients, it costs the NHS. The last strike is thought to have cost the health service around £300 million, and NHS leaders are warning that covering these costs could lead to job cuts in the future. Well, the NHS hopes to keep most of its planned care going during this walkout. Patients will inevitably be impacted, and this comes at a particularly difficult time, just as another challenging winter gets underway. Last month, A&Es in England had their busiest October on record, and now the flu season has hit early, so hospitals like this are under even more pressure. The NHS is advising people that if they have planned appointments, they should still attend unless they've been told otherwise, and of course, if anyone has an emergency, they should still call 999 or attend an emergency department.